What is piriformis syndrome? Well, it is basically a spasm or contraction of the piriformis muscle, which is a muscle that sits in our deep gluteal or deep hip region. Common symptoms of piriformis syndrome are this deep aching sensation in the hip and or lower back that may compress on the sciatic nerve or cause sciatic nerve irritation, and therefore symptoms through the glute and down into the leg. So like things like numbness or tingling. People will also report a lack of flexibility, or they lose some range of motion through their lumbopelvic region, and they may also have difficulty sitting because it directly irritates the piriformis muscle and sciatic nerve. Common causes of piriformis syndrome would be overuse type activities. So people who do lots of gluteal exercises, which activates that piriformis muscle that may cause spasm and then therefore cause all their symptoms. You may have direct trauma, so you might have like a hit to the buttock region that irritates the piriformis muscle, as well as having lumbar spine issues such as nerve irritation in the lumbar spine, which may then trigger piriformis contraction and therefore piriformis syndrome. Treatment for piriformis syndrome is pretty straightforward. Lots of soft tissue work to reduce the contracture, lots of stretching of the piriformis and surrounding gluteal or lumbopelvic muscles. We can do some dry needling to the piriformis. However, in the real acute phases, when that contraction is really quite painful, needling may not be the best option because it could be quite painful for sufferers. So they're the main strategies which we'll use to treat it. It's pretty straightforward and settles down within a couple of weeks of treatment. So I hope you found that helpful.